Hi, Larry. I'm honored to learn more from you today. You and I first met in 2016 when we were in the same CDC Global Health Fellowship cohort and the same HIV prevention branch at the CDC headquarters in Atlanta, Georgia. Your career reflects a strong commitment to advancing global health security and public health systems worldwide, from your early policy work at the National Academy for State Health Policy to fellowship and leadership roles at CDC in HIV prevention, voluntary male medical circumcision, and global disease detection, to your more recent work with CDC Foundation and WHO. You've contributed to critical initiatives, including event-based surveillance capacity building in multiple African countries, outbreak detection and response systems, and contributed to innovative digital platforms like Go.Data and EIOS. You've also played a key role in mentoring public health professionals and building networks that strengthen epidemiological practice across regions. Your trajectory from domestic health policy analysis to global epidemic intelligence and cross-country collaboration gives listeners a unique lens into how global health systems anticipate, detect, and respond to threats. I am so looking forward to learning more from you today.
Thanks, Larissa. Yeah, really good to see you. Really good to be here. Had a bit of a panic attack when you said 2016, and I realized that's almost 10 years ago now. But yeah, it's been quite the journey, working with all these different organizations, and now kind of continuing that work in different ways. And yeah, glad to be here with you now.
Yes. So jumping into the first question, could you explain what event-based surveillance is and why it has become such an essential tool in protecting public health?
Yeah, happy to. So event-based surveillance, or as we kind of shorthand call it, EBS, sort of the dictionary definition would be sort of a public health system for the early detection of health threats by systematically collecting and analyzing unstructured information from different sources. I like to call it taking a structured approach to a very chaotic and unstructured information ecosystem. And so these sources, a lot of them are internet based, but they can also be just various community members, social media, WhatsApp channels. It's very informal. Anywhere you might hear a rumor that could point you in the right direction to identifying a public health threat can be a source. And sort of it's become essential because, and also a useful tool with sort of the proliferation of the internet and some of these social media channels, because the information is more readily available than it ever was before. So it means you can get information faster. And obviously we call it kind of getting information for action. So information that you can then act on to, start that response, because time is of the essence in these situations. It's sort of meant to complement the more traditional surveillance model, indicator-based surveillance, which deals more with those formal reporting mechanisms. So think about your vital statistics, your death records, the regular reporting you get from clinics, health systems, even things like schools, where, yes, you can use those to determine that something might be going on, but those tend to be reported at a regular interval of time, whether it's monthly, quarterly, annually, et cetera. So by the time you see that there's maybe a surge in cases, let's say that you're looking at flu data and, oh man, we've had a lot more flu cases this month. Well, that means that it's already been circulating in the community for that period of time. Whereas if you had a way of getting that information sooner, you could have acted sooner to try to stem the outbreak. So one's not necessarily better than the other. When I was working with some of these places on different, capacity buildings initiatives, we would sometimes get the question, well, so we should focus on EBS. It's like, no, do both. In a perfect system, they will complement one another.
And what's EBS? Sorry, because this is for students.
Yes.
Event-based surveillance, right? Got it. Thank you.
Yes. And so, you want them to complement one another, feed off one another. And so where the advantage of EBS lies, though, is in the speed. But you do then have an additional step that you don't always have with indicator-based surveillance, which is that you have to verify, because the people you're getting this information from typically aren't trained in public health, or they're not, physicians, they're not medical personnel. Or if they are, maybe they're reporting things they've heard from others who aren't. So you have that extra verification step, but you're still getting information faster, and you can typically do that verification step pretty quickly.
Okay. Wow, that's great information. Thank you so much. Just move to the next question. Thank you for all that. In your work with countries like Liberia, Nigeria, Rwanda, Sierra Leone, and Uganda, what were some of the biggest challenges and successes in strengthening surveillance systems?
Um, I'd say the biggest challenge is just sort of, in all of these countries, they've got a million different priorities, and it's sort of getting the attention, the time, and in many cases, the money focused on event-based surveillance. You know, in the global health community, there's a ton of different partners, a ton of different initiatives, whether it's HIV, it's vaccination, it's, just general health system strengthening, it's sentinel surveillance. There's so many different kind of focal points. And so kind of getting your initiative off the ground can be tough. And it looks different in each country. Some are further along than others. When I was at CDC Foundation and working with CDC and others on this issue, you know, we kind of struggled. Like you named the 5 countries you ended up working with, but originally we had others that we had identified as countries that we wanted to engage on this issue, and they just did not have the bandwidth. So that's probably the biggest challenge. And then sort of understanding where each country already is, and sort of then distilling your objectives, your priorities to fill the gaps. And so some of those countries, they were kind of starting from scratch. Others were further along and had more resources in place already. So whereas some countries you actually had to work with them to train staff and just the principles of event-based surveillance, others you're more fine-tuning their reporting protocols, or you're helping them build up better data collection systems. So it really looked different based on each one, but we saw successes in each of the countries we worked with. And some we saw build call centers to better collect information coming in from the community. Others were building those data systems that they could better then report to the people who needed the information to take action. And then I think more broadly, just on the African continent, we saw the proliferation of EBS as a priority. We were working closely with Africa CDC, who turned out to really sort of they turned into like a real champion for EBS on the continent, and not in just the countries that we were partnered with, but with their member states more broadly. So that was really encouraging to see that, we had this little project of our own, but then watching that kind of grow and become continent-wide. And while we were focused on Africa, we were beginning to see that in other regions of the world as well, which was really encouraging.
Something that I was hearing you talk about that I want to highlight for students and people who are interested in global health and don't yet have much experience there, is that you can't make the assumption that if you're doing a multi-country program or working in multiple countries, that they're all on the same page, working at the same level, having the same situations. Like every country is really individual. I think in some ways this seems obvious, in other ways we always need to remind ourselves. So I think that was a really good point for students interested in multi-country programs.
Absolutely, yeah.
Next question for you. And if in these questions you have any specific country examples, feel free to give them, just putting that out there. How does collaboration between international organizations like CDC, WHO, and GSI, which is Global Health Security Initiative, and national governments work in practice when responding to emerging threats?
Yeah, and that's a good question. And I can talk about how it looked like when I was there. So just, for reference, I was working on these issues with the CDC Foundation and CDC from June of 2019 to January of 2025. So things have changed a lot since I left. And so I'll go over sort of how it was operating, but I understand that things are likely a lot different now. But at the time, it was very collaborative. There were a lot of different channels for sharing information because that's sort of the most valuable currency when it comes to public health threats. Everyone's kind of watching for them, or everyone in these types of communities is sort of watching for them. And a lot of people know more or less the same information, but if you know something different, it's important to be able to share that and have those avenues. And so I'd say one of the most valuable things that we had at the time was the World Health Organization chairs a group called the Global Outbreak Alert and Response Network. It's headed by their emergencies team, and the teams I worked with at CDC worked closely with that team. There were a lot of formal and informal relationships between those groups. And the Global Outbreak Alert and Response Network, GOARN, it's comprised of tons of partners that WHO works with. It includes the various UN agencies that might be involved in an emergency response. So that could be like UNICEF, that could be World Bank, it could be others. Could be, man, I'm blanking on the name for the refugees group. You would know this one.
IOM?
IOM, yep, IOM.
Or
OCHA was there
UNHCR?
too. So
What's the
yeah,
one you said?
is it OCHA?
Oh, yeah, OSHA and UNHCR. There's so many.
Yes. So all of
Yes.
those would be involved depending on the outbreaks that were being covered. Other humanitarian networks, different NGOs, International Red Cross, groups like that would be involved. And then I think every member state was welcome to have participation, and you would see a lot of them join. So that's, all the different national governments. And so there's a weekly call to share information on health threats. And typically the agenda would include information related to what outbreaks GORN was actively tracking, and then a space for the different partners to mention anything else they were monitoring that they thought the rest of the group should be aware of. So that was just great to have that channel, and there was a funding mechanism behind it. Partners would contribute to GORN, and if there needed to be a deployment, GORN could support deployments of experts from their different members to those settings where there was a response needed. I saw this most frequently on responses to things like Ebola and COVID, where it's like, oh, there's an outbreak maybe in DRC. We need to get some lab experts there to help support, and CDC staff could get deployed through GORN or others from some of these partner institutions. So very good mechanism for collaboration in dealing with emergency response. For the Global Health Security Initiative that you mentioned, that's a kind of a smaller group. That's the G7 countries and Mexico. They also had a group of analysts called the Early Alert and Response Network, EAR.
So many groups.
I know, so many groups, so many acronyms. You can really get bogged down in it. And the CDC team I worked with when I was at CDC Foundation, they served as kind of the CDC representative to that group, and I served as a rep myself as an analyst. And that we strategically scheduled our weekly calls to take place right after the GORN call, so that a lot of what we might talk about was already covered. We could keep the call shorter that way. But similarly, we would kind of be like, hey, one country would present on the outbreaks that they had detected that week using the system called EIOS that we will get to. But then afterwards, we would go around, well, is there anything else anyone else is watching? And so just being aware of what's happening in the world, where a response might be taking place, that's huge, like that situational awareness piece. So that was sort of how it would work in practice. And again, I don't know how it's going now. When it comes to kind of national governments, I will just add that can be a trickier piece. These are existing multi-government collaborative groups, but government to government can be trickier depending on the governments involved and the political sensitivities that might exist. I think we saw this with COVID. We certainly saw this with SARS back in the day. So when it comes to if there's something happening in a country, the good thing about CDC is that it has all these country and regional offices. So for that CDC team that we worked with, if we wanted to reach out, we would usually go through the office because they would have a better sense of any political sensitivities. But that was really more of a situational basis depending on what the countries involved were.
Yeah, I think for people listening, if anything, I hope you're getting the impression that there's so many players and stakeholders, and we're going to also talk in a couple. I have a question for you later about skills for students to focus on, especially now in a period where global health is changing so much, and it seems like communication and ability to work across different stakeholders and people and bring people together. That seems like you can't do any of this without that. But
Absolutely.
I'll ask you
Diplomacy is a
more.
soft skill that I would recommend um, learning for
Yeah,
this work.
besides all the other, thank you for all that technical information. That's awesome. My next question for you is about during the COVID-19 pandemic. During that time, you supported Go.Data and EIOS. So Go.Data is a WHO tool used during outbreaks to manage case investigations, contact tracing, and transmission chain visualization. And I'll put some information on the side of this video for the students. And EIOS is a global early warning system that scans open source data to detect potential public health threats before they are officially reported. So together, these two tools support surveillance by enabling early detection and operational outbreak response. So you supported those two important tools during this major global pandemic. What lessons do these digital tools offer for how we might respond for future pandemics?
Yeah, and I'm glad you gave that really excellent overview of what the tools are, because I think just going through them, you can hear how different they are. EIOS is very much on the detection side of the detection and notification side of the detect, notify, and respond cascade, and Go.Data is very much used as a response tool, right, for contact tracing and case management and things like that.
Can I pause you just in case someone doesn't know? Contact tracing is when someone tests positive for a disease, health issue, and then you find out who they were in touch with, who else might have been infected or affected. Just putting that out there.
Yes. And so in an outbreak, I think Go.Data's first sort of successes were in some of these Ebola outbreaks where contact tracing is vitally important to stopping the spread of the disease because of how it spreads. So knowing who an infected person might have had that contact with and then following that person to see if they become infected is crucial in sort of stopping the outbreak in its tracks. Um, and so, in terms of how these tools might, assist us in responding to future pandemics, I think kind of what they both showed is, EIOS was extremely helpful at the beginning of the COVID pandemic. It was where we first started seeing signs that something strange was happening in
Oh,
China. I remember seeing early media reports from Chinese media about a SARS-like pneumonia occurring in Wuhan. COVID is such a unique example because it was a new disease. And so that was the kind of the vocabulary they had to describe it. They were thinking back to the Wuhan outbreak, and they were like, well, this is like a pneumonia. It's sort of presenting like SARS. We call it SARS-like. And you see SARS, that's what got our attention at the time. But and then Go.Data is similar. It's an extremely useful tool in terms of managing large amounts of data, with, particularly an outbreak like COVID, where there were so many cases, a tool that can help you adequately crunch it, can give you the reminders on people you need to follow up with to check exposure, to check to see if they've developed symptoms since exposure, things like that. Go.Data can be really good for that. But I think what this has taught me is they are just tools. They're um, by themselves, they can only do so much. If you don't build the system in a way that can kind of maximize the use of those tools, all right, EIOS tells me there's a SARS-like pneumonia in Wuhan. Well, if the system isn't, in place that I can then tell someone who's going to act on that information, the tool did its job, but we didn't do ours. So you can use the tools to make the systems better, but the tools themselves will only go as far as the systems they're in allow them to go. And I think we've seen with both Go.Data and EIOS, when used well, they can be extremely valuable in helping systems respond well to outbreaks and pandemics. But, I think as COVID so ably demonstrated, if there are gaps in the system that, you're either not using the tools appropriately to plug them, or those tools aren't meant to plug those, the tools in and of themselves are not going to be enough.
Yeah, a lot to think about for the future. But moving on, a question about financing. So this is something I teach in global health about financing, but it's also something that's shifting so much right now. So maybe you can just give us a little bit of insight. How do financing, governance, and workforce factors affect a country's ability to detect and respond to outbreaks effectively?
Yeah. I mean,
Big question.
it's everything, right? Like financing, governance, and workforce. I mean, broadly, if you don't have the money, the will, and the people, it's just not going to happen. You're not going to be able to do the work. I think where event-based surveillance, global health security, outbreak response, all that has an advantage is governments tend to be supportive. It's very easy to make the case for the importance of the work and investing the time, effort, and money in that type of work, those types of systems. Think back to the 5 countries that you named: Sierra Leone, Rwanda, Liberia, Nigeria, and Uganda. Each of those in the last decade has had major outbreaks, whether it's the different viral hemorrhagic fevers, Ebola, Marburg, or Mpox, cholera. Obviously, they all dealt with COVID. So I think, with that experience, the countries understand the importance of outbreak preparation, outbreak response, and it's also become a priority at the international level for that reason. There's the pandemic fund, which is kind of spearheaded by the World Bank, which really seeks to help countries invest in these systems. And so, whereas I think before you would see a lot of focus on more what we would call vertical health programs that are kind of top down, focused on one issue, whether it's like, we're going to give X amount of money to focus on addressing HIV. We're going to give X amount of money to focus on malaria, and we're going to buy bed nets. Now I think you're seeing this more investment in systems more broadly that can be more flexible to different types of outbreaks. We would call this kind of horizontal health systems versus vertical. And pandemic fund, I think, is a real way of trying to do that. So I think the governance part is there. I think a lot of the governance players recognize the importance of this. Workforce is always a challenge in any setting, just because it does take a lot of highly trained people. And that's where the financing kind of affects both. These people are highly trained, they're smart, they're capable, they're well educated. If the money's not there, both to support the work that they do, but also to pay them, they will be forced to take opportunities elsewhere. So, and that looks the same everywhere.
That's such an important point.
Yeah, and so those are all, challenges that a lot of people are working on addressing. I think one exciting initiative I'd encourage students to look into is called 717. It's an initiative of Resolve to Save Lives. And sort of the goal of that, it's 717 itself refers to the target, which is 7 days as a target for detecting an emerging outbreak. So that's, 7 days from when the outbreak first emerges, say the index case, to when it's detected by someone within the system. 1 day to making a notification. So that's making a notification to whichever entity would be responsible to responding to that health threat. So that's from the time it's detected to the time the notification is made. And then 7 more days to initiate the steps of an early effective response. But within that framework of 717, Resolve has built this out in a way to kind of support finance, governance, workforce, using that as a tool for quality improvement to identify bottlenecks in your system, identify enablers where things are going well. And then even within that, once you have those bottlenecks and enablers, being used that in a way that you can either show results or advocate for support for priorities related to the challenges that you've identified and the improvements that you want to make in to address those challenges. So it's something that's kind of a new hot topic on the global health community. It's something that we were working on when I was with the foundation on with some of the countries that we were working with. And within that, Resolve has started a 717 Alliance, which includes different countries and organizations to try to put some more support on that governance piece, on that workforce piece, on that financing piece. So I think, you know, it's a hard question to answer succinctly just because it is so big. But I do think it's encouraging that a lot of people are working in different ways on trying to answer that question.
Yeah, that's great. Thank you for that example. I'm going to link that by the video. Thank you.
Excellent.
And a last question for you, Larry. Thank you so much already for all this great info. What are the most, in your perspective, what are the most pressing challenges and opportunities for innovation in global health security today? And what advice would you give to those pursuing careers in those fields?
Um, Sorry, I missed her. Can you run that question by me again?
Yes, the first part was, what are the most pressing challenges and opportunities for innovation in global health security today?
Yes, got you. So I'll give you kind of two. The first is the S word, sustainability, kind of links to the last question. I do worry about that. EBS is fortunately pretty low cost. If you have access to the internet, access to WhatsApp, access to um, you know, different community networks, you can do some form of EBS. There's no one way to do it. So that part is at least good for EBS itself. Um, but you know, when we were working with the countries, we were very focused on sustainability and what happens longer term. We had some funding, but we were constantly thinking about, well, what happens when our funding goes away? And you hope there's, excuse me, you hope that there is something that fills the void, whether it's the pandemic fund or any other one of these global initiatives. But for that reason, we would constantly try to think of, all right, well, what are tools that are either free or low cost, or maybe they're a one-time purchase. So if while we do have the funding, we can put this tool in place and the country can keep using it. So that was sort of our strategy in sort of building up some of the systems that we were working with at the time, and thinking about sustainability was trying to build it in a way that if priorities changed or if the money changed, the work could still be done. And so you focus less on what you might describe as a Cadillac model and more on, you know, that Toyota Camry will get you where you need to go. And kind of putting in place systems that were more resilient and could kind of survive some of these ebbs and flows over time. And the other challenge I think is more existential, and that kind of goes back to that question about the different networks and collaboration. And that's so much of outbreak preparedness and response has to do with information sharing and collaboration. And in the current environment, that seems to be becoming more and more of a challenge. And, you know, if you're not collaborating, you're not sharing information, the odds that something surprises you increase. And so
Great point.
I do worry about that in the current sort of climate where um, you know, maybe information isn't being shared as freely, or countries are afraid that if they share information on something happening, they might get punished. So that's kind of the more existential one. And then
That's
the
a great
second question
point.
had to do with advice for students, right?
Yeah, sorry, I'll break them up into two, but I want to just mention what you said is a really good point that global health, I think people forget that health affects all of us, that borders are like social inventions, like they're not, health doesn't stop at the border. So if different countries or regions aren't sharing information, it is, what's the opposite of a benefit? It harms all of us. So I'm really glad that you said that.
Yeah, diseases don't respect borders. I think it's been kind of a common, well-worn cliche since and that COVID made way too real.
Yes, yes. And then, okay, sorry about that before. My last question for you is about the advice for students. What advice would you give to those pursuing careers in global health surveillance, epidemiology, or health system strengthening?
Yeah, no, there's two parts. There's the hard skills and there's the kind of the soft skills. So for the hard ones, and this is what school is really good for, take your epi courses, get the data skills, data and visualization. That's huge. Don't shy away from those quantitative courses. I know a lot of people don't like them, but and then also try to keep up on the different, software package of the day. Over the course of my career, I've had to use Stata, SAS, Epi Info, Power BI, Tableau, Excel. Somehow
Mm,
I've not used R, but I'm trying to learn R.
the only
Um,
one I used. No, I used SAS too.
and it changes from organization to organization,
Mhm,
team to team. Like even within CDC, different teams have different data systems that they use.
mm,
So try to keep up on that because it is important. That data analysis and visualization piece, no matter what position you're in, you're going to need it.
mm,
And those skills are critical, and you'll always be valuable if you have them. And then beyond that, not only being able to like kind of crunch the data and visualize it, but then using it to tell a story to a non-public health audience in a convincing way. And then the other piece of advice has to do more with kind of the soft skills that we mentioned a little bit earlier and some of that life advice. Be patient, be collaborative, be humble. These are hard problems that a lot of smart people have been working on for a long time. If you go in thinking that you know the answer or you know everything, you're just not going to get anywhere. So it's a lot of listening, a lot of learning from others and understanding, and kind of knowing that you're working on these problems together. Your perspective will be valuable, and um, but then also knowing what you don't know is equally as important. And just the patience is huge. These are really challenging issues that people have been working on for a long time. Progress is slow and uneven. It will, it'll be going very slowly. Then all of a sudden you'll have a breakthrough, and you never know when that breakthrough is going to come. So kind of having that level of pragmatism. Don't let, I don't like this cliche, but it's kind of appropriate here. Don't let perfect be enemy of the good, knowing that sometimes the solutions are imperfect, but then you just keep building. So that patience is huge. Those diplomatic soft skills are huge. But if you go into it with your eyes wide open, it can be extremely rewarding over time. And when you do get those successes, they feel really good.
oh yeah. And you're basically saving the world. So
We hope.
yeah, we hope. Well, thank you so much, Larry. This has been excellent information. I have a lot of things to link now for follow-up for people. I really liked all those outbreaks you mentioned in the individual countries for people who don't work necessarily in global health. They might forget that there's way more pandemics and epidemics going on than COVID all the time in different places. So I think some of those individual ones you mentioned, like viral hemorrhagic fever and Marburg, those are really good to bring some awareness about for those who don't already know. So thank you so much. And overall, thank you for all this. And I hope you have a great day and we continue to stay in touch for at least 10 more years.
Thanks, Larissa. Always great to talk to you.
Yes. Bye.